My name is Titilayo Oyinsan, and it's time once again for the Blockchain Mastery Podcast. Now, this is becoming a real passion of mine, actually. I've had the opportunity to speak with so many really interesting individuals on different aspects of blockchain technology and, of course, its applications for the future. Hey, of course, blockchain applications go far beyond cryptocurrency and Bitcoin with its ability to create more transparency, more fairness, and also saving businesses time and money. The technology is really impacting many different sectors in ways that range from how contracts are enforced to making government work more efficiently. So it's been an interesting journey, and the journey continues today on the Blockchain Mastery Podcast. I'm going to be joined by someone very interesting. Ini Abasi Ekanem. Now, he's been building blockchain and Web3 products over the years. He has a keen interest in blockchain operations and business development. He's also a creative and a Python developer. And more importantly, he functions as a COO of MedPing. Today, we're talking about blockchain technology in healthcare. Welcome, Ini Abasi.
Hi.
Hi,
Hi, Titi.
how's it going?
Good. You're building. It's build season.
Uh, we're we're building. I like
Yeah.
that. I've heard that once or twice. We're building. We're
Oh,
building.
yeah.
There's a lot to be built, especially when it comes to blockchain. But at this point of the conversation, I would love for you to just let us in on exactly how you came in contact, the first time you came in contact with blockchain and blockchain technology, and why you decided to go into it. Talk to us.
Okay. I got to know about blockchain technology in late 2016. I got to know about Bitcoin in particular. Now we could remember the era of MMM, the era of Get Help, and all those Ponzi schemes. I got into Get Help then, and we were using Bitcoin for our Ponzi. Well, so we bought and sold Bitcoins, and what caught my attention was that the Bitcoins I bought at the beginning of the Ponzi scheme was worth, let's say, 100,000 naira. And at the end of the Ponzi scheme, which was in January or February, it was worth more than that. So I was really curious. I didn't have to know about the Ponzi itself paying me. This is the rate. And a few of my friends then back in school were also part of that. Dive deep into blockchain. Got to know about Ethereum. We got to know about many others. We got to know about so many other. As time passed, was bullish, so everyone made money. But I noticed that a lot of people were investing in blockchain technology, investing in what they never knew about. So I was like, if people are investing in what they don't know about, how about I build projects that have real value, create value? And I dived into blockchain full time. I started with creative writing, and then I got into operations and Python development. I deal mostly on REST APIs. Um, so we've built a whole lot of projects since then. I've worked with a lot of projects, collaborated with a lot of projects, the likes of FTX, CoinDust, MedPing, Spark, Atomic Wallet, and a whole lot of them. So building, and there is more to come because we're just getting started.
So I know a lot of the names that you called out just now, not a lot of people understand what those platforms actually are. You keep saying we're building, I've been on these platforms and that platforms, and it's just a lot for some people to understand. So I know that just like me, whenever you come across people who are just coming in contact with blockchain technology, there's a conversation you have, there's something you say, there's a way you explain it. So how do you explain it to the newcomers of blockchain?
Okay. Well, I'll say blockchain is basically replacing is basically being integrated in a lot of industries. So let's take finance for example. Now, before everyone was cash, cash, cash. You need to send money to someone, you cash, you go to the bank, you have to send money to the person. Sometimes it takes a long while for the person to get it. Now, if I want to send money to someone, I just stay here and send the money to the person with my phone. In a few seconds, it gets to the person. Now, I don't need to pay huge transaction fees. So, remittance companies or like charge huge remittance from Nigeria to someone in back then I could 200 naira. Send money to someone in Ghana, free app, download it, and I just send money to the person in Ghana. It would be 1 naira out of 10. Traditional remittance companies charge 100. I spending 1 naira to send money to Ghana 10,000. A whole lot of integration of blockchain technology in many companies or by many companies. Now, if you want to invest in it, I want let's talk about the stock market. I want to use the analogy of the stock market. Now, I feel like investing in Tesla, or I want to invest in Facebook, I want to buy their stock. Ordinarily, it would take me a lot of processes for me to buy their stock. Now, I don't need to pass through all those processes. All I need to do is go to ftx.com, register there, verify my documents, and I buy the tokenized version of the stock, or I buy the stock on the exchange. Now, FTX is a Web2 exchange, but they are focused on digital assets like Bitcoin, Ethereum, and they have stocks as well, like Facebook, Tesla, and others. So there's a lot of would I say ease of doing things with Web3 and blockchain technology. Now, we are here to talk about blockchain and healthcare. I can tell you that if someone needs healthcare, it's no more difficult like before with blockchain technology. Yes, we'll talk about that as the show goes on, but you should understand that what you couldn't access before, blockchain technology is making it easily accessible. And what you couldn't store securely, blockchain technology is making it easy to store your data securely and in an immutable form where no one can touch it without your permission. Yeah.
Okay, so now I'm going to take you back a little bit. You did mention that we're here to talk about blockchain and healthcare. First of all, are you a healthcare professional in any way, shape, or form? Your title gives us COO of MedPing, right? But a lot of people, once they hear healthcare, they want to hear of some kind of credentials, some kind of
Doctor.
degree that says exactly. So, um,
Yeah.
how do you fit into the healthcare space?
Okay. So, if you see, and I majored in electrocardiography
Okay, sorry,
contact.
I didn't hear what you said just now. I think the internet went out. If you could say what you said one
Okay.
more time.
And physiology at the University of Port Harcourt. So I have a
O-
degree in human physiology, and I
Okay.
majored in electrocardiography, which is the study of the normal functions of the heart. Yes, so I have first-hand experience of the healthcare industry in Nigeria. I
Okay.
served at Asokoro District Hospital here in Abuja, and I stayed there for a while after my service before I left. And I've worked with a lot of NGOs, healthcare facilities, so I have first-hand experience of how the healthcare industry is.
Mm. So
Yeah.
it's a lot of people make that assumption that a lot of people go into brand new things and start looking for new technologies when they didn't so to speak, make it in the chosen profession they were in. So I just
Yeah,
wanted to clarify that it's not as if you didn't have the credentials, you just found a real interest in moving
yeah,
the industry forward with technology. Now, speaking of
yeah,
technology, you mentioned earlier on that um, basically it is solving a problem, it's filling a gap, especially with
yeah,
regards your data. So what
yeah.
sort of data are you talking about with regards healthcare, and how does blockchain help?
Okay, so let's talk about healthcare data. If I go to the hospital now, an average government hospital, let's be sincere. If I want to find my results, let's say I did a test in the hospital last month or last 2 months or last year or last 2 years, and I want to find my results for that test. You know that on the average you won't find that result anywhere. Maybe it's in a pack of files, a huge dump of files somewhere. I don't see any reason why, if I travel out of Nigeria, let's say I go to Ghana or Kenya or I go to UK and I need access to those documents, I find it difficult to access those documents. That is an archaic way of doing things. Now, with blockchain technology, your healthcare data now at this point is called electronic health records, because it's not just your health information or papers, just papers as usual. It's now electronic health records are stored on the blockchain, where you have full ownership of the documents or your data, your records. Now, if I go to the UK and there is need for my previous tests or my health records to be looked through, all I need to do is go on the blockchain, access my records, and share it with my physician or my healthcare responder, and he will have full access to it and treat me better. Now, what this does is that it gives room for collaboration, better collaboration. So, a doctor in Nigeria who is my doctor, my personal doctor, here in Nigeria, I travel to UK, I have a doctor there. They can collaborate properly to ease and make my treatment better. So it's all about making care better. So most times our documents in Nigeria, or most healthcare institutions work that way. Our documents are stored in files, heap of files. So you're looking for someone who has an emergency, someone who is in a serious case of emergency and needs serious blood supply, or needs maybe a drug, intravenous drug, they'll give the person through the vein. Now, if that person reacts negatively to that drug, you won't know until you give the person the drug. Now, storing electronic health records on the blockchain helps you access that patient's record anywhere in the world. So all
Mm,
you need to do is check the previous history the person has had. Okay, the person reacts to chloroquine, so we can't give chloroquine. You prevented someone from dying while being cared for in a state of emergency. So I hope you
mm.
understand.
Yeah,
Yeah.
I do.
So basically,
Um,
we are eradicating the age of piling up of documents, missing documents, and difficulty in accessing patient data, patient health records. Yeah, and
mm.
improving collaboration in healthcare. Yeah.
So I'm thinking about the way the healthcare sector has been run over the years, and of course, technology down the line has, in quotes, speeded up or sped up
Yeah.
how documents are transferred with, of course, with the basics like email and even WhatsApp,
Yeah.
and maybe Zoom calls. There are apparently some surgeries that are even being done via Zoom, for instance, and the like. So
Yeah.
technology
So
has always been helpful in healthcare, but it does feel like blockchain has a very technical side to things. There has to be a certain language you need to understand before you can get involved with the back end.
yeah.
So do you see these technical aspects as limitations, and are they limitations that are easy to overcome?
So, like in the early days of the internet, we didn't have Python, we didn't have Rust, we had very few programming languages, but now we have numerous programming languages. Now, when you talk of blockchain programming languages, we have multiple blockchain programming languages, which are being simplified now. in the early days of the blockchain technology, far back 2010, it was not really easy to understand blockchain technology. But now the programming languages are simplified for developers to easily understand them. Now, when you talk of the limitations with blockchain technology when it comes to development and accessing the technicalities, um, I would say that it's no more like before. Why? Because most Web3 and blockchain solutions these days, you don't need to understand full blockchain development before you can utilize these solutions. Now, let's talk about MedPing. MedPing is a social platform for healthcare focused on improving it and care. Now, before he writes Ping, but I don't think it's before utilizing MedPing. These days are being an organization. You don't need to understand technology. You don't even need to be a developer. Integrate. Now, let's say box. You come to make now. You don't need to know how to code blockchain and the programming languages before you access this data. You can just come and copy this data and utilize it for whatever purpose is used for. Web3 APIs. We have a whole lot of solutions that are simplifying the technicalities of blockchain. That all you need to do is maybe a drag and copy and paste or drag and drop. These days, you don't need to go through this hassle. And you should also understand that there are public and there are private blockchains. So the difficulties associated with the public blockchains will I say, solved in the case of a private blockchain by only the developer end. So we, the users, the front end users, don't even need to understand what blockchain technology is. All we need to do using a private or public blockchain, we just come and plug in, come utilize, come type like MedPing now. I can simply go to MedPing and the MedPing web app, open the web app, register, log in, make my first ping, connect with the doctor. Nothing else. I don't need to even understand what blockchain technology is. Yeah.
What you're saying is you've connected the clients with the end users, so to speak,
Yeah.
patients
Yeah.
with medical professionals. But
Yeah.
now is this a public blockchain or is it a private blockchain you're using?
Public.
What are you-
Public.
Public blockchain. It does
Yes.
have the semblance of a social media platform. Was
Yeah.
that intentional? Was that intentional with Med?
Yes. Yes. Netping is a social network basically aimed at connecting, creating, and caring for one another. So it's basically a healthcare community, a global healthcare community that we connect and we care for one another. Healthcare professionals, where content creators, there are so many creators can get tips you about the heart, watches that video or user.
Okay, so it does seem like we've lost Ini Abasi's connection here, but he has been talking about MedPing. I'm going to go into the website a little more myself. It does have a semblance of a social media website, and it has posts on it, quite a lot of posts coming up on different aspects of healthcare. And it does seem like a very easy to use platform, Let's see. Okay, let's see what this is. Okay, so yes, obviously you log in and have your details here. Once you're registered, you'll definitely have better access to things. I can't exactly do my registration here right now, but I can see as of October 11th, the Center for Disease Control in Atlanta says 71,408 confirmed or probable monkeypox cases have been identified in over 107 locations around the world. So we did get quite a lot of CDC updates when COVID-19 was extremely rampant.